that sound means we're calling the Wayne County Commission Health and Human Services Committee to order. Good afternoon, everybody, and Madam Clerk, what do we have first?
Commissioner Marecki. She's excused.
Oh, she's excused, I'm sorry.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Baker McCormick.
Here.
Chair Colleen.
Present.
You have a quorum present.
Thank you, Madam Clerk. Next on the agenda, please.
B, approval of the February 11, 2020 meeting minutes.
So moved.
It's been moved and supported. Does anybody have any additions, corrections, changes to the minutes? Hearing none, all in favor of the motion, please say aye.
Aye.
Aye, opposed? All righty, Madam Clerk, what's next?
C, unfinished business. There is none.
Okay,
Item D1, under new business, requesting commission approval of an agreement with the Michigan Department of Health and Human Services.
okay, so it's a grant money coming in. I don't see the magic phrase on here, what do we call it, the omnibus, where the state sends us big money at the beginning of the year to run all of these health and wellness programs. And then, what is that called? The Michigan Comprehensive?
Hi, Carol Osterberry, Health Officer.
Yeah,
Yes,
please,
it's
help
the
me out there. Thank you.
CPBC, Comprehensive Planning,
Right.
Budget, something.
And I didn't
Yeah.
see that here, but that's what
No.
this is. This
You
is
didn't see
separate
it
from
because
this?
it's separate.
Okay. So this is a $811,000 grant to do what, Ms. Osterberry?
Right, it's to support those essential local public health services programs, but it is being awarded to the local health department through a Michigan compiled law, Local Community Stabilization Authority. And TR is here because
Right.
anyways,
Well, let me ask you first, Ms. Osterberry.
yes,
Have we ever received money this way from the?
no.
Oh, now I think I need an attorney. Sir, your name and what do you do?
T.R. Winter, Assistant Corporation Counsel from Corporation Counsel.
Welcome.
Thank you. We researched this, and although the act says it is revenue sharing, it is a law that was passed in 2014, and other municipalities and parts of the county may have gotten money from it from other sections of the act. But this specific section said that starting in 2019 for the calendar year, they would, if they certified there was money, they would allocate an amount to each local health department, and that's what happened in this instance. So it's not constitutional revenue sharing, which is in the Michigan Constitution. It's from a statute. For 5 years, other people have been getting money, including probably Wayne County, but health departments were given money as of this year, and it's designed to help defray the essential services which are not fully paid for by the money that we do get from
Okay.
the state.
All right, revenue sharing comes in two flavors, constitutional, and what do they call the other, legislative or? Statutory, there you go.
Statutory,
Yeah.
that's the
We've
term
got
we
a
use
former
now.
rep here with us. I don't know if our staff or our attorney understands this, because as far as you know, we haven't received money this way before.
We have not because of reading the statute, but your staff is who asked the question about, is this revenue or is it a grant? And it's
Right.
kind of, has aspects that it's similar to a grant because it's not revenue, but it is not technically a grant. There's no actual reporting requirements like a grant, but it is dedicated that it must be spent on public health towards the maintenance of effort services that are in the grant itself.
But the law says, don't bother telling us how you spent it.
I mean, I'm sure we're subject to review of it, but essentially the law just says it's to be given
yeah.
for this and used for that, yes.
But there's no reporting requirements back to the state for,
No, they sent a check or a ACH and a letter saying this is the
Wow.
money from this part of the statute for these purposes.
wow. So what's our plans for 800,000, Ms. Osterberry?
Yes, we are going to add staff in the food service program, the environmentalists. We're able to add new positions there, and also for our hearing and vision program.
The which program?
Hearing and vision,
Okay.
and when I say add, that's newly created new positions.
Because they have directed us to, please give me your understanding how they're directing us to use these funds.
Right, for any of the allowable costs for the essential local public health services programs, the food service program, hearing and vision program
Really?
are certainly two of those, so.
Any? That's, would you please submit a list of how you're gonna spend it, like how many environmentalists
absolutely.
are we gonna add?
Yep, yep,
Because, you know, keeping track of that,
yep.
that's been a number that's been of interest, how many people we have out doing restaurant inspections and all of those things. So to see where, you know, where we're at with that.
Yep.
And anywhere else. So it's like manna from heaven, huh? As far as this goes, and it's a one-year thing, I would assume.
It will continue.
I believe it will continue as long as this appropriation is in effect, that the statute did not have an end date. It had a beginning date for this, and other people have been getting certain funds for 5 years on it.
What locals have?
Non-health departments, yes, local
Yeah.
governments were getting some money from this from the beginning of the statute, I believe.
And I'm going to go to Commissioner Baker McCormick in just a sec, but I have one other question. How do they determine that they have money available for this? What, is there like a formula that we're going to get it every year? You know, is it like an Act 51 roads formula that now there's a formula and we're just going to get this until they change the formula? Does it depend on state revenues? What's available? What do you know about that?
What we found was mostly in the body of the letter that the local community stabilization authority in Lansing met and certified that our health department had been spending enough funds. They did not disclose how the funds were allocated to different health departments or what criteria they used to make that judgment, and the statute is pretty much silent on how this stabilization authority works.
I'm sorry, Commissioner Baker McCormick. Mr. Abbo, our Commission Finance guy, are you aware of this? What was the name of the authority that we got this through? The
Local Community Stabilization Authority in Lansing, it's a state.
Are you familiar with this authority? It sounds like it's at arm's length from state government, right? We have an airport authority,
Compiled law.
right? We have other kinds of authorities. Who the heck are these people?
The
And
letter they-
and where do they get their authority from?
The letter they sent with the check, which was on HHS letterhead, says that on Friday, November 15th, 2019, the local Community Stabilization Authority approved distribution of these payments.
I'm going to assume that's an appointed board,
We were,
that it has a board.
We weren't able
I
to
think
find
maybe we
anything out
should look
about it.
into this, Mr. Abbo, to see what that is, for our own purposes and understanding the county budget going forward, who these people are, who appoints them, if it indeed is appointed, what their charge is.
Where they get their funding.
Yeah, and how they get the money from the state, but what is the charge that they're given? Sounds like they're supposedly some sort of a referee for not constitutional revenue sharing, but statutory revenue sharing. Perhaps there's a formula or something out there that they, okay. I'm sorry, Commissioner Baker McCormick, your floor.
Thank you, Mr. Chair. You said that the authority, I guess, has authorized funding since 2015. Is that correct?
it's authorized funding for other units of government, not for this health department.
Okay, that's what I was gonna ask. So do we know why or why not?
The portion of the statute that talked about health departments said that it was to start in calendar year 2019. The other portions had different start dates earlier than that.
For different municipalities,
Or
Their
different
start
parts
date.
of government, yes. I mean, it
Okay.
was not, I don't think it was naming municipalities by name, but it said for this purpose, it starts immediately, and this purpose, it starts a year later, and for
Okay.
local health departments, it was 2019. And in answer to the question before, Nellie Lee provided, there is a website that lists the members and has about a paragraph of what it does. We can, you know.
Mr. Johnson just went and ran that off, so there's something here. It was created in 63, under an act in 1963. It looks like, no, it was established in October 2014. Other parts of that act went through in 63. I'm sorry, it's your floor, Commissioner Baker McCormick.
And for the vision and hearing, what did you say you were going to,
Adding staff.
okay, just staff, no additional services, just?
Well, then they
or-
will be doing more services. That's,
Okay.
you know what I'm saying? That's, yeah, they'll be out doing those, the same services. It's the same services, but certainly by adding staff, then we will be able to serve, more of the children in Wayne County for hearing and vision screening.
Okay, so just clarification, so we will be providing additional services with the money, or?
Essentially, I mean, yes, but like I say, by adding on staff, then yes, we definitely. Yeah.
Right, but you could potentially just add on staff and not provide more services,
That
because the
isn't-
staff might cost, it depends on how many staffers. That's what I'm
Sure.
asking.
And the
yeah.
intent is for more services to be provided with this additional staff, absolutely.
And so do we know how many staffers, and did
Yes,
we
that's what,
talk
right,
about
I'll
that?
provide that.
Okay.
For hearing and vision, I think it's gonna be 3.
3, okay.
Mm-hmm.
Yeah, and if you could say what, because I know you go out to schools with the hearing
Sure.
and vision. So if you could also comment, we're adding these people, and this is what we see as an increase of services. Because I think in some cases too, I know like with people that do the restaurant inspections, they got to hustle. They got to hustle to get, and it may be, and I'll just throw this out, I'm not in the department or anything, but by adding 3 or 4 people or whatever the number is, we might have more thorough inspections that go on and people can take, instead of you got 15 minutes and you got to keep going from place to place. I'm just throwing something out, I'm not accusing or anything like that, that maybe they're able to spend a little more time when they do their inspections. But yeah,
you.
I have a document here that I'll share with Mr. Abbo. As far as we know, this is going to be year after year funding at the same level?
That is what, and believe me, I've asked, and that's what I'm being told, yes.
So my guess is you don't have it in writing. Yeah, sure, that's what we're going to do. All right, we will. Other questions on this item? Mr. Abbo?
Yeah, I was just able to look on the internet. Apparently, this was a program that was from the state of Michigan, and the calculations to funding is done by the state treasury, and the authority does not have that detail. So we'll see if we can find out what the formulas are.
Yeah, that would be great to see, if this is actually locked in. I don't know, you referenced the health department, and that kicked in 19?
Yes.
I don't know if in other categories the county has received dollars through this. Yeah, I know, because it wouldn't be in your department, but I think that would be interesting to know as well.
We'll see if we can find the formulas and how they're determined.
Appreciate that, Mr. Abbo. Mr. Anderson,
Thank you.
Commissioner Anderson.
Just, yeah, it was approved in its Act 86 of 2014, but it was local community stabilization authority receives their or certification of the amount paid to municipalities, and I would assume the same for the county. Michigan Department of Health and Human Services
Yeah.
approves it, but I was there at the time that would have passed through the Senate, but I have to plead that I don't recall.
Yeah, yeah, well, a lot of things go through in the details. So hopefully, we're gonna learn a lot more about this as commission and commission staff and understand this. I'd really like to know how these people become members of the council too that are making these decisions. Questions from committee member? Council,
So it's a 5-member board appointed by the governor.
they're directly appointed by the governor. Okay, excellent. Do you know from just what you looked at whether the new governor has appointed or are these folk? I got you. You're looking at the statute. The governor gets the appointments. Okay. Thank you, council. Committee members, questions? Pleasure of the committee. It's been moved and supported to accept $811,000. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Abstentions? All righty, thank you. Madam Clerk, I guess we're on to the addenda.
Item 2 on the addenda, requesting commission approval of a grant agreement with the State of Michigan Department of Licensing and Regulatory Affairs.
Okay, staff contacted me hour and a half ago to say we've got another one. And also, and so this is another grant that's coming in, and we'll hear about what it is in a second here. But Mr. Albrecht, would you like to explain, we have a slight twist here in accepting this grant? If you explain to the committee what you explained to me.
For sure. So, the item that you see before you, it has 3 attachments, and they're just not labeled. And so, the department is here today seeking committee approval contingent upon those attachments being labeled prior to full board. Because otherwise, everything, from our perspective here seemed to, be up to snuff, so.
And staff will be able to make that note on the full board agenda that indeed all the paperwork, and maybe even say a little bit if it was a lack of labeling or mislabeling.
Okay.
To give people a little indication, right, that it wasn't like we had to redo everything, right? That it was a pretty straightforward bookkeeping matter, you might say. Mm-hmm. So, in our discussion today, if we are moving to accept this, we'd be moving in on contingent upon that being available to us at full board. With that, Ms. Osterberry, welcome back to the table. And, boy, here's another $500,000 for you. From Lara, Licensing and Regulatory Affairs. What is this grant going to be able to do for our health department?
Yes, we received this grant last year, and this is for the medical marijuana education and outreach. And again, because we had this grant last year, we're kind of excited about then having it again this year and being able to just really build upon what we started last year as far as education and outreach. And this is just really the acceptance of that award, for this. Again, a lot of this is, last year the campaign was much more, there were videos, Google ads, billboards. This year, because we anticipated this coming, we're actually hiring on a part-time employee who will be going out in the field. We are also continuing with our outreach campaign that will, like I say, just build upon what we had from last year. I don't have the exact details on that. That is, Central Communications is working with the ad company on that. And when we get that finalized, then that contract will come before you. But, so, like I say, we're excited, especially because we're able to hire on this part-time employee and have them more really out in the community, doing more outreach about medical marijuana, what it's all about, but it is for medical marijuana.
Right, you've made that clear before, as our health officer, right? But are you also interim department head, or
No.
who's the interim department head up there now? Well, that's
Is
okay.
Janelle considered?
Huh?
Janelle Allen.
Oh, it's Janelle is doing it. So what is the message as the Wayne County Health Officer that you want to get out regarding medical marijuana?
Right. A lot of the messages, there are misconceptions for pregnant women. They think that partaking in medical marijuana is, to help with morning sickness, and that is not at all the case. There are messages for families regarding if you have someone in the family who's on medical marijuana and keeping that supply safely stored, locked, very secure from anyone in your household who maybe, doesn't need to be using the marijuana products for medicinal purposes. Many other messages about, and I've seen a lot of the ads, just saying, don't drive high. It's still, it's a agent that you shouldn't be operating a, vehicle on.
What
So-
about the beneficial
There are
effects?
some, right, and then I think that's gonna be our second, portion of, I do know that for certain medical conditions, many people have expressed, it really helps them with, if they're going through chemotherapy. I have a personal
that's-
friend
yeah,
who's,
'cause
personally, I know that from, someone who I know. And I think there are some other medicinal benefits for different,
Because I would like to see, of course, keeping it away from kids and that kind of stuff is important.
right,
But over at Nortown Collision on Van Dyke between 7 and 8 Mile, it's been there forever. Bunch of old guys run that thing, and I went to visit them one day. They used to be in my district, and they're like, "Oh, Joe's out with doing his chemo today. He'll be back tomorrow." So I went and visited him the next day, and I'm sitting back, as you can imagine, the office in a bump shop, and stuff is everywhere, and I'm sitting there jawing with him, and his daughter walks through, and he says, "Have you told him about the marijuana brownies yet?" So here's a guy on chemo, he's like, "Oh, it's been so helpful to me."
Yes,
In
that's
his
what
late 70s, right, the last guy in the world, you would think, especially those of us that came up in the 60s and 70s, the last guy in the world would be saying, "Oh, yeah, marijuana brownies, yeah." But I think many people have found the benefits of that, and I think that should also be part of the campaign out there
Absolutely.
because it does alleviate. Questions from committee members, or Commissioner Dobb and then Commissioner Baker McCormick?
Thank you. Just one quick question. So last year in 2019 was the first year that we received this grant, and was that also the first year that we started the campaign regarding the informational campaign regarding medical marijuana, or had we done it
Yes.
using any other funds before then?
Yes, the first year, no, we hadn't used it before. In the past, this money also always went to the Wayne County Sheriff's Department. And then things changed last year that this is not to be for law enforcement.
Okay, thank you.
Thank you, Commissioner. Commissioner Baker McCormick.
Thank you again. So for the advertisement, you talked about some of the ways you would use it and what you would publicize. If, I don't know if vaping is part of that or would be considered in that communication?
I don't, again, like I said, our communication staff is really working with the marketing. I don't know.
Wouldn't that be a separate category?
Yeah, 'cause you don't.
This is for medical marijuana?
It's medical marijuana.
But I thought there's different ways in which you can use it, just like
Right.
food, and there's different ways you can smoke it.
Right, and
And
like I
so-
said, I don't know. That's,
Right.
I honestly just
And
don't
so
know.
I was just wondering with the dangers out there of vaping, if that's part of maybe, if you're using medical marijuana, the best forms of use
Right.
is, or there's been evidence of if you use a vapor, then it may cause, so, I don't
And I
know.
think they're having those discussions.
Okay, great.
If
Thank
you would, thank you, Commissioner. If you wouldn't mind, Ms. Osterberry, because you are going to send us, we're going to hire more people with that other grant, and this is what they're going to do with the first grant we approved. Would you mind answering this question back to committee chair or the committee staff? If vaping is involved, I don't know. I don't know, if a doctor says, here's your medical marijuana card, stop by the vape store and get vaping equipment. I don't know. But if you could answer that question to committee staff so that we can give it to everybody on committee that has heard the question today and might be wondering what the answer is on that. Because, I see the potential, Commissioner. Yeah. Any other, Commissioner Anderson?
Real quick, I thought we just had something along this line. Maybe I missed it in the discussion, but recently we had a grant for the same thing.
That's the same. I think it was that, they had to bring it to management budget for that's all, just to certify.
Okay, all
Yeah,
right.
Yeah.
Thanks.
Yeah, there's.
Yes, you,
Yeah, there is that two-step process, right? And then maybe even a third step when we look at what Ways and Means did on stuff that affects our budget, and we review those too. So you might see it 3 times. Go, where did I see this before? Questions on this? Pleasure of the committee?
Support.
With, how do we say it?
Contingent upon
Contingent upon
revisions being made?
proper labeling. Yeah, okay. Any further questions? Proper motion, all in favor, please say aye. Aye. Opposed? Are there any abstentions? All righty, we'll roll the agenda. Madam Clerk, what's next?
E, such other matters as may be properly submitted before the committee.
Does anybody have some such other matters? Commissioner Baker McCormick does.
Just wanted to get feedback and at either now or later on. We talked about previously about a youth commission component. I believe I talked to a couple of commissioners about that. But I am in the process of finalizing what I think that would look like. And if you have any suggestions or input on what you want in a youth commission. And basically, it will just be like a mentoring program and to educate young people on what we do and bringing up a new generation in government. And so if you have any questions about it or again, if you have any input you would like to see in such a program, just let me know.
You're envisioning countywide?
Yes, definitely countywide.
I don't
Yes.
think I've, do you have a little paper or something that outlines
I
this?
will have that very
Yeah.
soon to
Okay.
get to you. Yes,
And I think we should
definitely.
figure out which committee might be the appropriate committee to look at a proposal on this. And I don't know where that would be, but you're not the first to try, and I hope you're the most successful to try to get it through, because I think it's an excellent idea. Thank
you.
Yeah.
Thank you. I just think it's important for us to continue to reach back and make sure that we train the next generation on what we do. And, so,
Couldn't agree more. Look forward to the proposal.
thank you.
Yeah.
Thank you.
Any other some such matters? Hearing none, Madam Clerk?
Public comments.
Any member of the public wish to address the Health and Human Services Committee? Any member of the public, as everybody looks around? Any member of the public? Hearing none, Madam Clerk, what's next on the agenda?
Adjournment.
Okay, well, without objection then, we stand adjourned.